you need to know how to take care of your baby's scalp. Do you have a 1-month-old baby and you notice thick crusting or scaling in your baby's scalp? You're worried, should you shampoo as usual? Well, it might be cradle cap or seborrheic dermatitis in infants. It is very common in babies. It causes crusting and yellow or white scales. Well, it can appear in your baby's first weeks and then it slowly disappears over a couple of months. It is not usually itchy or it would not make your child uncomfortable. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms or dads deal with child health problems to raise happy and healthy kids. In this video, we are going to talk about cradle cap. What is it? What causes it? What are the ways to treat it at home? How to prevent it? And when should you worry and call the doctor? Cradle cap. What causes cradle cap? Well, nobody knows for sure. It might be from mom's hormones during pregnancy, which contributes to the overproduction of the oil glands in baby's scalp. It might be also from the yeast in the oil. Well, the sebaceous glands or oil glands are found in baby's scalp. And when there is an overabundance of oil, the skin cells would remain stuck in baby's scalp. What is important is that it causes no harm to your baby. So what are the signs of cradle cap? Well, there is redness with brown crusting, yellow crusting that resembles fish scales on baby's scalp. The scales appear flaky, fragile, waxy, and greasy to touch. Cradle cap is seborrheic dermatitis that is limited to baby's scalp. When you notice redness or flaking or crustiness in your baby's eyebrows, under the neck folds, behind baby's ears, under the armpits, then it might already be seborrheic dermatitis, and you should let your doctor know about it. How do doctors diagnose cradle cap and or seborrheic dermatitis? Well, your doctor simply does a physical examination, and how the skin appears already signifies the diagnosis of cradle cap. There is no need for laboratories or biopsies. How to treat it? Well, if your baby's seborrheic dermatitis is limited to the scalp, then you can treat cradle cap yourself at home. Here's what you need to do. Wash baby's hair with mild baby shampoo every day. Then massage baby's hair that is lathered gently with your fingers, or you can use a washcloth. After that, gently brush baby's hair to help remove the scales. There are combs available which are especially designed for cradle cap, or a soft toothbrush can also work. Remember, do not use your fingernails to pick at the scales because it might cause bleeding or it might lead to an infection. An alternative might be petroleum jelly, where you can leave it on baby's scalp overnight and then the following morning you can brush it off. You can also use over-the-counter cradle cap lotions. What you do is to apply it 15 minutes before shampooing your baby and then rinse it off after shampooing. What you can also do is do not use baby oil. It is not effective, and in fact, it helps build up scales. There are also over-the-counter steroid creams that are available, which your doctor might prescribe for your baby's cradle cap. So what are the ways to prevent cradle cap? You need not worry. Cradle cap is common in young babies, and it does not mean poor hygiene or lack of care. What are the ways to prevent cradle cap? Well, use a soft brush and brush baby's hair to help remove the scales, and shampoo baby's hair often. And then, when should you worry and call the doctor? What should you expect when your baby has a cradle cap, or how will it affect baby's hair? Before we talk about these, well, do you have a newborn, or you're an expectant mom or dad, and you have trouble breastfeeding? What are the ways of soothing a crying baby? How about postpartum depression? Are you worried you might have it? Well, I have an online course known as the 5 Newborn Care Strategies. Do check out my website with the link provided in the description section. So when should you worry and call your doctor? You should let your doctor know if the cradle cap has not resolved after 1 week of prescription treatment, if the rash has already affected the neck, the armpit, or the diaper area, if your baby still has cradle cap beyond 12 months of age, or if there is already infection. What are the signs of infection? If there's draining liquid, if there's foul odor, if it appears red or very painful, if there are blisters. Cradle cap is a scalp condition that happens in most babies. Don't worry, it's harmless and doesn't cause pain, itching, or discomfort on your baby. It happens in the first weeks of life, and it usually disappears by the time your baby is 12 months of age. The good news is that you can treat cradle cap yourself with a simple at-home treatment that we have just discussed. You can also discuss other treatment options with your doctor. Well, you should use a mild shampoo 2 to 3 times a week to prevent cradle cap from happening again. So how will it affect baby's hair? You need not worry. Cradle cap will not prevent your baby's hair from growing. It also will not cause baldness. Only in very rare cases will it cause temporary hair loss. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.